Well, the rise in COVID-19 infection figures comes through at a time when South Africa is bracing for an influenza season in just about 3 weeks. Now, the average flu season in the country starts during the first week of June, peaking a few weeks thereafter. Joining us now to look at the threat of COVID-19 colliding with flu is Professor Jeffrey Mphahlele, who's the Vice President for the Research and South African Medical Research Council. Thanks so much indeed for joining us this evening, Prof. So the flu season is coming. Normally, we get our flu shots, drink lots of lemon and tea, but this year it will come with a global pandemic. How does that complicate things? Hello, Prof, can you hear me?
Good evening, sir. Can you hear me now?
Yes, we can hear you now. I was just saying that the flu that we get every year is on its way, and in the midst of a global pandemic, how does that complicate things?
They really complicate things because if you look at the epidemiology of both viruses, the novel coronavirus and influenza virus, there are a lot of similarities. Both viruses can infect anyone, regardless of age and gender. And we do know that in terms of the clinical presentations, there is a huge overlap between these two viruses. They both give you relatively short incubation period, literally less than 5 days, and then you already get symptoms. And the symptoms are all respiratory, related symptoms, which you can find in influenza as well as in the novel coronavirus. So there are a number of similarities, including the mode of transmission of both viruses.
And we have to
so there are some real complications.
All right, but we have to be careful, though, because we don't all get the flu. Sometimes we just get a cold and we call it the flu.
Absolutely. So in most cases, we often mistaken flu or coronavirus or common cold infections with influenza. And but there is a way in which we can differentiate between the two because we do have laboratory diagnosis for these viruses. And in fact, what I see happening this year in terms of differentiating between COVID-19 disease and influenza disease is really the laboratory diagnosis. We will rely very much on laboratory diagnosis. Fortunately, we can use the same sample, which is a nasopharyngeal swab, or maybe the throat swab that we can use to detect both viruses. And what it means is that we need to be on alert. We need to increase surveillance, and we need to make sure that where we suspect influenza virus, we are able to do detection for both viruses.
All right. Okay, let's start just for the benefit of our viewers, because I know that some people will just have a mild cold and they'll think that, all hell's broken loose. Is there a difference between flu and colds that we can tell? And then we'll check the difference between the coronavirus and flu just now. But let's start with just a common cold and when you've got flu.
There are some differences between the common cold and influenza. For influenza, you do get a short incubation period of the virus, literally 2 to 3 days, and you get sudden onset of high fever. And in the case of common cold, fever is usually gradual. And for influenza, you get other respiratory illnesses like headache, myalgia, and so on and so on. And in complicated cases, you can get pneumonia for influenza. And it's not the case, of course, with a common cold.
All right.
Usually common cold gives you a runny nose.
Right. Have we had deaths from flu in this country? I know that thousands have died in the United States.
Yes, we do have mortality due to influenza virus. So influenza is associated with excess morbidity and mortality. And this we get almost every year in the country. It's just that because we have been with influenza for many years, we don't seem to take notice of this mortality and due to influenza.
All right, so now the difference between flu and COVID-19, is that harder to tell?
It's hard to say because for the novel coronavirus, this is a new virus. So we do know that there are some clinical presentations that one can tell, but then these clinical presentations can vary depending on the age group. You have had some cases in the US that children who have got COVID-19, they do present with atypical clinical cases, very strange, symptoms that are not seen in adults. But for the classical cases of COVID-19, maybe there might be some differences because with COVID-19 you can get shortness of breath, for example, which may not necessarily be the case for influenza.
Right. Okay, so, the world has been researching COVID-19 for some time now. First surfaced December last year, so we're sort of 6 months into the game now. And I know that you've been funding some research here in South Africa. How much do we know about this novel coronavirus now? A lot more than we did, let's say, 6 to 8 weeks ago?
So it's true that the South African Medical Research Council is funding a number of research projects to understand COVID-19 in our setting. What we know at this stage is that this virus, or maybe let me say that the older age group is more prone to this virus, and you see high mortality in the older age group than any other age group. So that's number one. And number two is the fact that those with underlying health conditions like cardiovascular, diabetes, hypertension, and so on, they tend to suffer the worst consequences of COVID-19 infection. So we are still looking at the research to understand how the virus is infecting HIV positive and the TB infected patients. And we are also funding research to understand how the virus, for example, what would be the outcome in pregnant women, because this is also an important group to study. And funding research also to understand the interaction of COVID-19 and influenza. So there are a number of projects that we are funding.
All right. In other parts of the world, it's come out that ethnicity might also play a role in terms of vulnerability. And in America, African Americans were seen to be a little bit more vulnerable than their Caucasian counterparts. Does that make us in Africa in that higher risk category?
We are looking at that closely, and obviously we can't tell at this moment for our population. But I would like to believe that in most cases is because of the socioeconomic status
Right.
of those who are affected. So obviously, if you belong to the lower category, you will tend to be affected more because when you have got infection, maybe you are not able to really get the kind of help, medical help that you're supposed to get. So even the diet, even other, social issues come to play. So this could actually, exacerbate the severity of infection.
All right, so we often now hear headlines, winter is coming, and also we heard President Donald Trump at one point suggest that things would get better once summer has come in the United States. I wonder, has there a link been made between COVID-19 and seasonal weather patterns?
Not at the moment. We do know that most of respiratory infections they tend to be more frequent and predominate in the cooler months of the year, depending on where you are. Whether you are in southern or northern hemisphere. So for the COVID-19 disease, we still have to see whether this is a seasonal infection and more predominant in the winter season, or is a year-round kind of infection. So time will tell. At the moment, we really don't have a very good answer.
Is it possible to have both flu and COVID-19 at the same time?
I'm sure it's possible to have both viruses together. And the reason being that, especially for South Africa, we're getting into the winter season, and this is going to be the flu season. And with the exponential cases that we see with COVID-19, I've got no doubt that we're going to see a number of co-infections with both viruses. So the good news is that we do have laboratory diagnosis for both viruses, and the best really to differentiate these two viruses is going to be early and rapid and accurate laboratory diagnosis, so that you are able to guide appropriate therapy where you have got a laboratory confirmation of which infection is actually affecting a person.
All right, and perhaps finally, your research that you've been funding, has it given any indications about things that are peculiar to South Africa that we need to perhaps manage differently to other parts of the world as yet?
Not quite at the moment, but we are hoping that we will be able to contribute solutions to problems that are unique to Africa, not just South Africa. As I said earlier, we do have a problem of comorbidities, especially HIV and TB. So these are unique in most African settings. And we have got a number of projects in both rural and urban areas to look at the behavior of COVID-19 disease in patients or in individuals with HIV and TB. So research is still ongoing, and I'm sure after maybe a few weeks or so, we will be able to get a full analysis of the results and understand what is the impact of COVID-19 to these comorbidities.
All right, we will certainly look forward to that information, and perhaps we can talk to you at that point. But for this evening, thanks so much indeed for joining us and sharing your insights with us on the program. Thanks so much indeed.
Thank you.
All right, that was Professor Jeffrey Mphahlele, who's the Vice President Research at the South Africa Medical Research Council, talking to us about COVID-19 and the flu, of course, which is on its way. This is flu season, so could complicate things for us in South Africa.